Hello, everyone, and welcome to MSK Unknown Case Series, week 46. Here we have a phenomenal MSK ultrasound case. But before I begin, please subscribe to the channel. Please support our mission in spreading free knowledge to the world worldwide. Okay, so this is an ultrasound case of the heel of the Achilles tendon. Okay, we have a left Achilles tendon ultrasound and we have a right for comparison. Of course, the left one is abnormal. Okay, so I want you to take a look at these images and answer the following question that I have. So what's the most likely diagnosis in the left ankle? And I've given you a right for comparison. Is it Achilles tendinopathy, partial tear of the Achilles tendon, complete tear of the Achilles tendon, Haglund syndrome, or a xanthoma of the Achilles tendon? I want to go back to the images now that we have the answer choices and talk about this. So this is a normal Achilles tendon, right? So the layer between here and here, this is the subcutaneous tissues. This hyperechoic fibrillar area from here to here, this is the Achilles tendon. Okay, it should be normally hypoechoic with fibrillar linear echogenic lines. These are the tendon fibers that we're seeing here, and this is the normal thickness of the Achilles tendon. Contrast this to this image here where the thickness of the Achilles tendon is nearly double that of the right side, and there are calcifications within the Achilles tendon. So this is a nice example of what Achilles tendinopathy or degeneration of the Achilles tendon would look like. Now, this is not a partial tear because we don't have anechoic defect that's spanning part of the thickness of the tendon. So it's not a partial tear. It's not a complete tear because we don't have an anechoic defect through the entire thickness of the tendon. It's not Haglund syndrome because I haven't shown you, retrocalcaneal bursitis or, the osseous bump along the posterior superior process of the calcaneus. If those were also present, this would be the Haglund syndrome. And this is not a case of a Achilles tendon xanthoma because we don't have, lipid Latin histiocytes deposit here. That would look like heterogeneous hypoechogenicity of the Achilles tendon. You may have hypoechoic nodules within the tendon itself. This is just thickening of the Achilles tendon. So the best answer here would be Achilles tendinopathy. And as I said, tendinopathy is thickening or degeneration of the tendon. And the Achilles tendon, of course, is, one of the biggest and strongest tendons in the body. Typically, depending on who you read, up to 8 millimeters to 10 millimeters. If the AP dimension of the tendon measures more than a centimeter, even I actually use 8 millimeters, I call that Achilles tendinopathy. And the same is true on MRI. Typically, you can have increased vascularity if you put flow or color Doppler on, and there's increased flow within the Achilles tendon. That can also be a sign of Achilles tendinopathy. And another important feature of Achilles tendinopathy on both MRI and ultrasound is if the anterior fibers have a convex contour, that's suggestive of Achilles tendinopathy. Usually, it should be flat or concave. So if it's convex, that's another sign of Achilles tendinopathy. And I want to show you just some more ultrasound images because I know not everyone does MSK ultrasound. This is a transverse image of the Achilles tendon. This circular area here is the Achilles tendon here. There's tendinopathy and there's thickening of the tendon. This is a more normal appearance of the Achilles tendon here, okay? And if we were to put color Doppler on here, notice that there's increased vascularity here. So this is a nice example of what, tendinopathy would look like with increased vascularity of the tendon itself. Normally, the tendon should not be this vascular. So that's another way to assess for Achilles tendinopathy by putting color Doppler. Very important in real-time ultrasound examinations. And this is a nice example of what this is a extended field of view image because the Achilles tendon, remember, is very long, right? It starts at the mid calf, with contributions from the medial and lateral gastrocnemius and soleus muscles and tendons. It comes in here, it inserts, of course, onto the calcaneal tuberosity. We can see this here, this hyperechoic, curvilinear structure with posterior acoustic shadowing here. This is the calcaneal tuberosity where the Achilles tendon is inserting. But notice, this is, the skin surface, and this is, this here is a retrocalcaneal bursa. But notice the anterior convex contour. See how it's bulging out towards the bursa, right? So that's abnormal, right? So it should be flat or actually concave the opposite direction. So this also is another sign of Achilles tendinopathy, this bulging convex contour along the anterior margin of the Achilles tendon. So hope that was helpful. Hope that was a nice case of Achilles tendinopathy. Please subscribe to the channel. Tune in next week for another high yield MSK unknown case. Thank you so much for your attention.